Bruising. What exactly is a bruise? The medical term for a bruise is ecchymosis. Bruising occurs due to physical trauma, what we refer to medically as contusion. The bruise itself essentially is extravasation of blood, which means that the blood which was otherwise contained within capillaries, the smallest of the three types of blood vessels they actually break. So let's go back. Capillaries are found inside tissue. Capillaries are only 1 cell thick, and it is through these that you find the artery. It is a continuation of the artery, which is relatively large, or otherwise it becomes an arteriole, which is a slightly smaller branch of that, and then the arteriole goes on, and inside the tissue itself becomes the capillary. That on one end is the arterial end of the capillary, on the other end is known as the venous end of the capillary. So it's the same structure. They're actually connected. It's what we refer to as the capillary bed, which is found inside the tissue. That venous end of the capillary becomes the venule, a smaller version of a vein, and that becomes the vein which carries blood back to the heart. The capillary bed it is which actually does the exchange of metabolic waste. Now, when we have physical trauma, because the capillaries are only 1 cell thick, they are so small, the contusion that is, the physical trauma that is, it actually breaks the capillaries. There is actual physical destruction of these. This then leads to the blood that would otherwise be inside those capillaries and contained to actually spill out, and that's what we refer to as extravasation. Now, because of the hemodynamics, this usually can take a little while to develop, so 24, 48, up to 72 hours, because the blood that's now outside the capillary, to actually manifest itself subdermally, so it has to rise to the surface. So after a few days, this is usually blue, black, purple, and then after a few days it might become yellow before it then disappears as the hemodynamics through the area improve, and we get neovascularization, formation of new blood vessels, which is essentially the recovery period. If, however, the larger blood vessel is damaged, then there's a larger amount of blood that actually remains in the extravascular component, and that then pools. That pooling leads to a lump, a huge clotting, and that lump is known as a hematoma, which can be tender to palpate, they can be lumpy, and they sit under the skin, and that again occurs due to contusion, except a more significant one, and that leads to damage of the larger blood vessels, which is known as a hematoma. Thank you for watching.